Welcome to Deep Roots with NaijaBabeInTexas, the show that brings insights, stories, and strategies to empower your personal, business, health, and professional journey. I am your host, Ogechi of Deep Roots with NaijaBabeInTexas. Today's episode is about the importance of men's health. We are diving into men's physical, mental, and emotional wellness health. A special guest is joining me for this vital conversation, Dr. Obinna Ozigbo of Zima Medical. So let's get into it. Dr. Obinna, welcome to the show.
Yeah, good morning, Ogechi. Thank you.
Oh, you're
Thank you for having
welcome.
me.
Thank you for participating in this conversation and sharing your insights and your experience. But before we get started in getting into the discussion, can you share your name with the audience and also the meaning of Obina? I always like to get people a little bit of insights about our own heritage as well. So if you can share your name, especially the meaning of your name, because I just told them what your name is, but the meaning of your name, and then tell us about yourself and your current role, and then we can get into more discussions.
Sure, my name is Obinna Ozigbo. I'm a physician. Obinna is an Igbo word. It essentially means destiny. Obi means, if you literally translate it, Obi means heart. So what it essentially means is destiny. What God has destined will eventually come to pass. So that's the basic meaning of Obinna.
That's powerful.
Yes.
It's important when our parents give us names like this because it really, I feel like it leads us to where we're, in your case, where you're destined to be, right? That
Yes.
whatever it is you do, you'll be destined in that thing that you're doing. So very, very fitting name.
Absolutely. So I grew up in the southeastern part of Nigeria, specifically in a place called Enugu.
Okay.
I went to medical school in that same region, University of Port Harcourt specifically, and came to the United States more than 20 years ago to New York for advanced training in internal medicine. After that, I moved to Texas. I now run a medical group called Zima Medical Group. Basically, I'm the owner of that group, and we are internal medicine physicians, most of us. I'm the owner and the leader of the group. We also have advanced practice providers. So we basically run outpatient clinics here in San Antonio, Texas. We see adults. Internal medicine is essentially medicine for adults.
That makes sense because you have for children, isn't that pediatrics? Makes sense. I never put that together, so it makes sense. Okay. So today's topic is about men's health, right? Before we go into our segment where we talk more about understanding men's health, why do you think men's health is overlooked or compared to women paying more attention to their health, even though I still feel women can do better, but it seems like they do much better than that.
Yes, by far. So if you look at the statistics, let's use the US for example. Women live at least 5 years more than men. The life expectancy, men die 5 years younger than women. I think part of the reason is upbringing. Men often struggle. Boys are raised to be strong, not show any sign of weakness, bottle their feelings. So because of that, men do not typically seek healthcare the way women do. They don't participate in a lot of preventive care. And this is just a generalization. It doesn't apply to everybody, but it explains some of the things we see, some of the outcomes, some of the health outcomes. From physical health to mental health, suicide is more in men, and men are less likely to seek therapy than women, and they're less likely to go to the doctor's office. And we see this all the time. So it's a crisis situation because common medical illnesses like high blood pressure, diabetes. Some men see that high blood pressure as a sign of weakness, so they typically do not seek professional help like women do.
So what I'm hearing you say basically is the silent crisis about men avoiding healthcare really it's based on the fact that, like you said, from a statistics perspective, men live 5 years less than women do. But the
Yes,
reasons why they don't is really more so from a sign of weakness because we have a macho culture where they think that they're okay, they can solve everything, right? They need to go see a doctor for anything. So the way our culture builds men to feel like you're strong, you should be strong. So therefore, you ignore certain things that you should actually take seriously. Compared to women, they take their children to the hospital. If they're not feeling well, they take action, right?
exactly.
Men are just focused on taking care of the family, doing what they need to do, but not really putting their health as a primary um, task for them to do, for lack of a better term, right? I
Yes,
tell
that's
people,
correct.
if you don't take care of yourself first, you can't take care of anybody else. Just like on the plane, put on your mask first before you put it on your child or anybody else. So it should
Yes.
be the same principle that every individual, men or females or women, should be able to apply to. Okay. Is there anything else that you want to add as to any social stigmas or fear of diagnosis that limit men from, either understanding their health or not going to see a doctor?
Yes. Let me take sexual health for example. Women are more proactive when it comes to talking about sexual health, from erectile problems to decreased libido to low testosterone. But men, because of our culture, men tend to, these things affect their self-esteem. They may not bring it up with their partners, and they are unlikely to bring it up to their doctors. What I see in my practice is that in many instances, the female partners bring up these issues for men, but the women walk into the clinic and let everything out, tell you what's going on with them. But the men, most of the time, do not bring it up, unless I bring it up myself, which I do very frequently. Even sometimes they're evasive about it because they do not want you to perceive them as being weak. So it's the perception that's the problem. The way people feel, men feel more embarrassed than women bringing up these issues,
Okay.
with their
Okay,
doctors.
makes sense. And I think also women tend to, they're the ones giving birth, right? So they tend to go to the hospital for one thing or the other, especially during childbearing, during that 9 months. So there's that consistency from that perspective. I'm just thinking of it from a biological perspective, but that's a very insightful feedback. Okay, so let's get into some key topics, right? That every man should know. You've touched on some things, but I think we need to go a little bit in depth, right?
Yes,
Cardiovascular health, sexual and reproductive health. So let's talk about those two things, why it's important, from the physical and sexual health perspective, why those things are important.
absolutely. So, like I said earlier, both men and women have these problems. High blood
Mm,
pressure, specifically, which is what I'm going to bring up because it's a crisis. High blood pressure, but the men do not. Most comparatively, men are less likely to even check their blood pressure at home unless they're very enlightened, or for lack of a better word, or sometimes it's their partners or their spouses that bring these things up. People feel that taking blood pressure medication makes you less manly. So because of that, you see more men who have untreated hypertension. You see more men who have heart disease resulting from the hypertension. You see more men having strokes as a result of hypertension. The women have these things also, but they get it addressed right away. So you have a society where the high blood pressure is spread across, but there's no difference in terms of gender, but the outcomes are different. And the average life expectancy of women maybe is about 80 years, 80.6, and men is about 76 or thereabouts. And yeah, the problem is the response to it.
Being proactive about it, basically, and
Exactly.
taking their medication,
Taking
getting
medication.
screening,
Yes.
stuff like that, right?
Yes.
And
Yes,
just
absolutely.
simple, when you say simple lifestyle changes that can help with the cardiovascular health, what do you mean by that?
Um, Low salt diets.
What they eat.
Yes,
Okay.
exercise. The American College of Cardiologists recommend 45 minutes to an hour of exercise at least 5 days a week. But when I talk to my patients, I tell them anything that's going to make you sweat
Okay.
for an hour.
Okay.
In a way, they'll understand
Fine.
anything that'll make you
Okay.
sweat for
Okay.
45 minutes at least 5 days a week. Um, so exercise, diet, rest. So culturally, many men believe they have to be providers, to
Yeah.
right. So because of that, people are under a lot of stress. Men are under a lot of stress. They don't sleep well. Put their cardiovascular health at the bottom
At
of the
risk.
list. Yes, put it
Hmm.
at risk. So those are major things: high blood pressure, prevention of high blood pressure, or management of high blood pressure, which can lead to heart disease, which can lead to stroke, which is we call CVAs, or cerebrovascular accidents, and these things can also lead to kidney failure. Yes, high blood pressure affects the heart, it affects the eyes, It puts people at risk of glaucoma. It puts people at risk of
Oh, wow.
blindness and including dementia,
Okay.
So these are very important things. So with regards to sexual health and reproductive
Basically,
health, so because many men comparatively do not go out of their way to do this, I mean, when you compare them to women,
you
to get
mean
screenings,
like women go to get their
women go
go
and
to
they
their
ask you, I want to check my,
OBGYN.
exactly,
Yeah.
they tell you they want to check their hormone levels.
Uh-huh.
A good number of men do this, but when you compare them to women, you find out that less men do this than women. So I'll give you an example. Let's talk about erectile dysfunction. Over 40% of men over 40 years have erectile dysfunction. But this is the problem. That in itself could be a sign that something else is going on
Within the body.
within the heart, in your cardiovascular system. It could be
Oh,
a sign
wow.
that you're having problems with blood supply. It could be a sign that you're diabetic. It could be a sign that there's a problem with blood flow somewhere. It's not just it's a reproductive issue, it's a lifestyle issue, but it could just be a sign that something is going on. Someone could have that for 5 years or 6 years and not realizing that the primary cause could be diabetes, which is, high blood sugar and problems with the nerves. So if you go to a doctor, if I see you in my practice and you mention something like this, I'll start more investigations. I'll look
Mm.
at the testosterone levels. So the point I'm trying to make is when someone is having problems with sexual
Erectile
health
dys.
function, they should go to a doctor and be investigated for something else. It may not be just anxiety. Yes, anxiety contributes stress because if you're working too hard, you're tired. If there's a lot of pressure for you to provide for your family, you're tired. But it could also be that hey, someone is diabetic and they don't know they're diabetic or they have high blood pressure. So
Yeah.
that's the thing.
So from what I'm hearing you say is not checking your for lack of a better term, your manhood. Just like we
Hmm.
females, we check our womanhood. Not checking those things on on a yearly basis can create other problems because it is not just about your manhood. It is about other things that could be related, that could be health related that you need to address sooner rather than later. And so once
Yes,
there are signs of erectile dysfunction, as an example, that is the reason why you really need to go see a doctor ASAP to be able to check yourself and make sure that everything is okay, inclusive of other potential issues. Because I know you as a doctor, what people don't know is I do know Dr. Obinna personally, and he has taken care of um, family members of mine. And he is very, very thorough with what he does. And so I can actually hear him tell somebody, okay, if you're having this problem, let's talk about this, but let's also do research to figure out other things, inclusive of
yes,
blood work or whatever it is that's required to find out what other things could be to make sure that your levels are good. And if they are great, if they're not, then at least it's an option to be able to figure out other things. Okay.
that is correct.
Okay. So you also talk about, you haven't said this here, but I know that in our pre-conversations, we've talked about testosterone levels and prostate health and PCA screening,
Yes.
which are kind of tied into the whole sexual and reproductive health. Is there anything that you can tell people as to why testosterone levels are important to check, as well as erectile dysfunction is one thing, but prostate health is really what we're saying you need to check on a regular basis that would include other things. But any other addition to that
Yes.
conversation
So testosterone levels tend to decrease with
as you
age
get older?
as
Okay.
men get older. Just as women are worried about menopause and
Mm-hmm.
perimenopausal symptoms, men have their own equivalent. That's why checking testosterone levels are important. And in some cases, the testosterone supplementation might be needed to enhance your sexual health or reproductive health and also keep your family or relationships intact because
Mm-hmm.
these things affect relationships. Now, the other big one is prostate health. So I'm just going to talk about two things here. There's what they call a prostate enlargement, which you call benign prostatic enlargement or BPH or benign prostatic hypertrophy. That's what we call it, BPH. Then there's also prostate cancer. So they typically with age, prostate gets bigger.
Mm-hmm.
and people have problems with urination, wake up every night, early at night to urinate. And if you go regularly to the doctor, these are questions they will ask you. They will ask you questions about, do you wake up at night to urinate? Do you find it hard to void? And they will decide if you need to be referred to a urologist.
Mm. To
That's
void, what is to void? Sorry.
to urinate. To
Okay,
urinate.
okay,
Yeah,
okay.
to urinate. So, but if you don't go to a doctor and you keep these things to yourself, or you don't recognize this, or you've never heard about this, you wouldn't know. Um, the other part of it I want to talk about is prostate cancer. So, prostate cancer screening is done with a blood test called PSA. From the age of 40, we start screening men for prostate cancer. We do yearly PSA levels. And when the PSA starts rising, we get worried. There are other things that can raise the PSA, but we get worried. Okay, does
Mm-hmm.
this person need to be screened further for prostate
Mm-hmm.
cancer? And prostate cancer is one of the commonest causes of mortality. One of the commonest cancers in men. Let me put it that way.
Mm-hmm.
Yeah.
Mm-hmm.
And it's something that, because it's usually slow growing, you may not get it, you may not catch it on time unless you do regular annual checkups. So, and it's one of those things that's curable. That's the thing. It's completely curable if found early. We're going to talk about other screening tests that need to be done, but for now, I mean, we can. Those
Those
are
are the
the,
main
the
things.
important ones, yes.
Ones, yeah. So really, with physical and sexual health, as it relates to cardiovascular health, it's important that, and also sexual and reproductive health, it's important that people get their annual checkups, is what I'm
Yes.
hearing you say. And in
Yes.
those annual checkups, you're checking for high blood pressure, cholesterol that could lead to heart disease. You're checking for testosterone level. You're checking their postrate that could require PSA screening, and if they have any erectile dysfunctional issues, checking for that. It's also important that the men are open and honest and transparent as to these physical or sexual health issues that they're experiencing. Because you can go to the doctor and do your annual checkup, but if you don't tell him what's
Yes.
going on, he can't help you. So you have to be able to open your mouth and say, here are some things, because it's a two-way communication relationship.
That is
Open
correct.
your mouth, share what your issues are, your concerns. Sometimes I tell people, write it in your, with these our phones that we have, write it in your note section so that when you
Mhm.
get there, you remember. You know, when
Yes.
I was married, I used to force my husband to, have you done your annual checkups? We pay for these things. Why have you not
Yes.
done it, right?
Yes.
To make sure that he goes to get those things checked. As I'm getting mine checked, he's getting his checked, right?
Yes.
Sometimes you wait till the last minute, till the end of the year. But the bottom line is we need to make sure that our spouses, our friends, I was talking to a friend the other day, he's like, Ogechi, you know I'm a man now. I'm an typical African man. I'm like, what does that mean? Your health is your health is your health. You have children. So we want you to be here as long
Yes.
as possible for your kids, for your wife, for your family, for even your friends. Be safe. I need you around, so please go and check yourself. So that's what we're
I
going.
see.
That we're going to wrap that section up with
Yes.
that, and then we're now going to talk emotion because this is my passionate part, right?
Yes.
Mental, emotional health, and social well-being. I think we all know that men are not great with going to therapy,
No.
addressing issues that they have, even talking amongst their friends sometimes is hard, right?
Yes.
So we females or women have a better network, I think, with regards to discussing our issues. Men are not good at it. So mental health is just as important as your physical health, right? Because
Yes.
it's, for me, it's in the inside, and sometimes you can't see the inside. It's only how you're feeling that you can express. So let's talk about mental, emotional health, and social
Yes.
well-being. Why that's important.
So, thank you. So, men often struggle in silence when it comes to mental health. The reason is that because many are raised to be strong and not
Yeah.
show their emotions. Boys are told to be strong, take charge, don't be weak. And this can lead to bottling up of feelings, which increases the risk of depression, anxiety, even suicide.
Mm-hmm.
Of course, men are less likely to seek help or talk to a therapist. So basically, The main thing is the solution to this is to tell men it's okay to talk. And
Yeah.
mental health, mental strength includes asking for help when you need it. Talk to a therapist, talk to a friend, go for regular checkups, and I think we should organize community outreach
Yeah.
and talk to men across board. Hey, it's okay to ask for help. Asking for help is not a sign of weakness. Asking for help is actually a sign of strength.
Mm-hmm.
I talk to patients in my clinic every time about depression and anxiety. I'm talking about men this time around. I say to
Yeah.
them, if you ask somebody, are you depressed? They'll say no. That's the usual answer I get. And I'll
Mm-hmm.
say, okay, tell me about your daily. Do you find it difficult getting out of bed? Do you find that you've lost interest in things that you normally like to do? Do you see yourself feeling sad uh, when you're not supposed to for no just cause? Do you sleep well? How many hours do you sleep at night? Do you wake up frequently? Are you struggling with sleep? Tell me the things you're struggling with. And I say to them, there are things I struggle with. Do you see yourself emotional? And have you talked to anybody about this? When you
Mm-hmm.
ask people those kind of questions, they will slowly open up.
Yeah.
But when you ask people, someone, because of the word, because of the
That word
stigma,
suicide. Yeah,
yeah,
that's the side,
stigma.
right?
Or if you say
Exactly.
depressed, they'll say no, they don't. And I'll say, okay, take me through your day. Tell me what your day is like. Are you happy at your job? Are you, it's say. So I try to explain to them. It's when you say depression, it doesn't mean you're getting a medication. It doesn't mean anybody's gonna tag you. This is your mental health. We need to talk about it. The other part of it is anxiety. Many people experience one form of anxiety or the other. The question is this something that you can live with? Is this something that's affecting your daily life? And when I bring up these issues with them, I ask them specifically, tell me what bothers you most. Tell me what you're not comfortable doing. So it's something that we should encourage people to talk about because the thing about mental health or emotional health is it's you can't run a blood test
Yes.
to
To figure
tell
it out.
to figure it
Yes.
out.
Uh-huh.
People just have to tell you,
Yeah.
but you have to ask also as a physician. You have to ask issues around mental health. You have to get the question. You have to go out of your way as a physician to ask your patients those questions,
Yeah.
and that also applies to reproductive health.
Yeah.
They don't typically do not volunteer
Information.
information that way, and
And
like
I
that's
and I would say another thing that we don't talk about when it comes to mental health is that sometimes it is hereditary, right?
yes,
And the fact that it's hereditary does mean that you may not have it as bad as whoever it is in your family line that has it, right? But you may have some aspect of it. So if you do know that it's hereditary, it's important that you also pay attention to it with the way that you manage individuals manage their own lives, right? I just thought to bring up that aspect because when something is hereditary, whether it be cancer, whether it be it's even high blood pressure is hereditary, right? And if it is, most likely you're going to probably have some aspect of it. You may not have it as bad as somebody in your family does, but that's the more reason why you have to manage your health and understand your health even more.
yes. Let me just take a little bit about that one. So depression and anxiety run in families, which means that genetics play a role, even though there's
Yes.
no particular identity. Scientists haven't identified any
There's
particular
it.
depression gene.
Yes.
But if you have a parent or a sibling with depression and anxiety, your risk is higher.
Yeah.
But that doesn't necessarily definitely means you won't. That doesn't mean you will definitely have it.
Yes.
Also, the things like serotonin and dopamine levels in the body, and the way people react to stress, sleep patterns. These things affect people's behavior. It affects
Mm-hmm.
anxiety and depression, which is why many of the medications we use in treating anxiety and depression alter these levels. So, I mean, the bottom line is that genetics can raise the risk. Family history can help you be proactive, get support, manage stress, and talk to your doctor when needed.
Yeah, yeah. And I do like the aspect that you said you are asking the questions, but you're asking them in a way that is not making them feel like they cannot talk about it, right? It encourages them to talk about it because people go through life issues, right? Whether
Yes.
you've lost a job, whether you lost a brother, a sister, whatever, grief, all those things they impact you from an emotional perspective. And so it's really important that I tell people it's be proactive. If you're going through grief, go to therapy. You never know what you get out of it, right? If you're going through a divorce, go to therapy.
Yes.
Sometimes it helps you to manage the stress levels or just manage the issue that you're dealing with. And it reduces your ability to have anxiety or about those things that you're going through or that we deal with on a day-to-day basis in life. So,
Mhm.
if that makes sense. All right.
Yes.
Okay. Weight, nutrition, exercise. This is more around the social well-being. I think you've talked a bit about, working out or exercising,
5 years.
whichever way, 45 minutes, 5 days a week. You've talked about a bit of salt, but any other diet tips for muscle or
Yes.
longevity or metabolism in men? I didn't know there was
Yes.
metabolism in men. I hear more about it with women, so that's interesting.
Well, that's part of the problem because men don't talk about it. That's part of the problem. So there's metabolism is not a gender restricted word. It's both
Uh-huh.
on both sides. It happens to men and women. Yes, in addition to physical exercise, should men and women men should cut down significantly on processed foods that have a lot of salt, high sugar content of food. So we typically ask patients to avoid a lot of simple sugars. Things that have high glucose contents that can spike your blood sugar. And by that, I'm talking about something like soda. Those things have a lot of glucose content. Your body needs glucose. I'm not saying you don't need glucose, but there are people who drink 5 sodas a day and they think there's nothing wrong with it. And it's a habit. There are people who drink soda with every meal. And I
Oh
encourage
wow.
them, but yes, why don't you change to water? It's healthier and it's healthier. It's probably less expensive. I think it's probably
Mm-hmm.
less
Mm-hmm.
expensive because you can get it anywhere. And the other thing is people drink a lot of sweet tea. So this is very important. Sweet tea is like soda. It's just like adding soda to your coffee, to your tea. Juice is like soda without caffeine. So juice has a lot of glucose in it. When people have a low blood sugar, what do we give them? Orange juice, pineapple juice. So those things have a high
To
glucose
spike
content.
up their sugar level when they have
Exactly,
low,
exactly.
yeah.
So these things have a high glucose. So essentially, people should avoid processed food that have a lot of salt and a lot of preservatives. They should avoid things that spike up their blood sugar because in the long run, it affects your glucose content and it can even push you to become diabetic, so to say. Weight gain is another issue. So alcohol. Let me start with beer. Beer has a lot of glucose, a lot of carbs in it. It may not have as much alcohol as the average wine, but it has a lot of carbs. So people that drink a lot of alcohol accumulate carbs, a lot of carbs, and it affects their weight, affects even their sleep. It affects their sleep. And recently, a recent publications shows that there's no amount of alcohol is safe for anybody.
Oh
So
wow. All of
yes,
them are all bad.
so yeah, a recent publication says no amount of alcohol, but these studies come out and if you publish something, scientists are going to look into it and do some more studies to see whether that is something that's actually true.
So
So
everything in proportion is what I'm hearing. You don't
yes,
overdo it, right?
no, it's
Don't overdo it. Some
not
juice,
overdo it.
but make sure you are looking at the content and you're not drinking it morning, afternoon, night. Drinking
Correct.
5 sodas, I don't understand that. Well, I kind of do because from a cultural perspective, especially us Nigerians, when we eat, we like cold soda, Coke, to go with whatever it is that we're doing.
Or
Whether it's
juice.
bread and Coke, oh, whether
Yes.
it's I'm talking about when when those of us that have lived in Nigeria,
Yes.
even puff puff self, puff puff and a cold bottle of Fanta, Coke, whatever, it just makes you feel better, right? Not to talk about when you're eating fufu and all those things. I can see it, but when we know better, we do better. I mean, I'm not a soda person. I have my own vices, but it's not soda. Thank God for that. What I'm hearing you say is exercise.
Yes.
Be careful with your salt contents. Be careful with alcohol, not doing too much. Sugar content.
And of course, smoking. I didn't mention that one. Smoking.
Yeah,
Yes.
everything
Smoking.
everything is bad for you, but it's really not bad for you. There are studies that have shown, especially with smoking, impact of it. Even just inhaling smoke from people who smoke is just as bad as the people who smoke it, in my personal opinion.
Yes. Secondary
And so
smoking is huge.
is huge. Smoking is not good for you. I know somebody that I hope is going to hear this message. As you can hear, Dr. Obinna said smoking not good. So off it quick, quick. So alrighty. So let's talk about, I think we've kind of dabbled into some of these proactive. We've talked about things that are very important, right? So both physical and sexual health, mental, emotional health, and social well-being, right? And so now we want to get into the part of unpacking how we can be more preventative with our health, right? We've touched on it a little bit, right? And lifestyle choices that we make. You want to go into this and just talk about some
Yes,
of those common screenings and things that need to be
absolutely.
done? Because at
Now,
the end of the day, we want people to be more proactive versus reactive. So, what can they do now?
good. So, in addition to, so I'm going to kind of categorize lives. I'm going to talk about lifestyle choice. I'm going to talk about lab tests and things they need to do. So,
Okay.
let's start with lifestyle choices. Things like, low alcohol. If you're drinking a lot, you just need to significantly lower your alcohol intake. Two, no smoking, absolutely. That's one of the smoking is the commonest preventable cause of mortality and morbidity.
Um,
So it's preventable. There's so many things tied to smoking: lung disease, heart disease, strokes. So that is a no-no for anybody. Increase physical activity, exercise regularly, 45 minutes to an hour every day, 5 days a week. Sleep. Get 7 to 8 hours of sleep. If you can't sleep enough, check yourself report that to your doctor. You might have what they call sleep apnea. Now, when it comes to get your annual check, when it comes to clinic visits or visiting your doctor, get your annual checks yearly. Then make sure you get your kidney function, your liver function checked, your cholesterol levels, thyroid, and a diabetic screening. So these 5 things are important. Lipid panel, that's a cholesterol check. Get screened for diabetes. Have your liver checked. Have your kidney checked, and
what
your
about their colon? What about their colon? Having their colons checked as well. Isn't the colonos? Is it
Oh, no, no,
colonoscopy?
I'm coming to that.
Okay,
I'm
perfect.
getting to the age. So,
Okay, so you're starting with the basics. These are just
basic,
the
these are the
basics
basics,
of it. I
basics for
got you.
everybody. Now, for men, when you get to 40, you have to have a PSA done, unless you're having symptoms of prostate enlargement before. Maybe something you're having difficult time peeing, or you're having a difficult time, you're waking up frequently at night to urinate. So, at 40, the PSA, that's when we start checking the PSA. Some people start a little bit later, but because they statistically in certain demographics, minorities, black people, prostate cancer tend to happen earlier.
Mhm.
So I check everybody from 40 years old.
Okay.
That's looking into prostate health from 40 years. PSA checks every year. At 45, everybody gets a colonoscopy. At
Mm,
45, unless they have a strong family history of colon cancer, then they get the test at 10 years earlier.
mm.
But if they have symptoms like bleeding all the time when they go to the restroom, when they have a bowel movement, then they need to see a gastroenterologist or a rectal specialist and have that checked. It may not be cancer, but it could be something else. So as people get older, they will start doing an evaluation. Maybe when they get to about 60, 65, we'll start doing what they call a mental state exam to see if they're forgetting things. Start
Oh,
screening for
dementia and all that
dementia.
stuff.
When I say dementia, people panic, so I just use the word cognitive impairment.
Oh, okay.
Cognitive impairment, we'll start checking for their hearing. Now, the things that people need to pay attention to, major things are like hypertension, diabetes, heart disease, stroke, problems with circulation. Another important thing is
Oh, yes.
dental health and
I.
health for your eyes. So
Mm,
people need to be screened for visual impairments,
mhm.
glaucoma, and retinal exam if they're diabetic. Whether they're diabetic or not, they need to be screened for that. Dental health is also important. People should go to their dentist. I think dentists recommend every 6 months for cleaning out.
Every 6 months for
6 months for
cleaning.
cleaning.
Yeah.
And if they have cavities, it should be filled. So that's the other important thing. So essentially, people need to be screened for diabetes, hypertension, sleep apnea. That's another thing. Sleep apnea, so if somebody is overweight, they need to be screened for sleep apnea. Any
Okay.
adult, it doesn't matter how old they are. It's common and it's a cause of so many problems. Sleep apnea essentially means I'm going to say it in a way that people understand. Sleep apnea means that when you sleep, you don't get enough oxygen and That affects your brain, affects different organs, it predisposes you to heart disease, hypertension, and diabetes. The commonest sign or symptom of sleep apnea is snoring. And
Okay.
people tell you, oh, when they wake up, oh, okay, they feel so tired, they've slept for 8 hours, they feel they haven't slept. And how do I? Most of the patients I see in clinic with sleep apnea tell me they can't sleep at night, that they wake up every 2 or 3 hours to urinate. I ask them, do you urinate in the daytime every 2 hours? They say no. So I realize that it's not the urge to urinate that's waking them up, it's something else.
Okay.
Yes.
Okay.
There's something else I want to add. I know we'll have to round this up.
No, it's okay. More information that.
So in
Mm-hmm.
in female transgenders, they need to be screened for these things, especially prostate health. If someone is a female trans, you still have your organs intact, you can still have prostate cancer.
When you say female trans, are you,
Yeah,
or
so if
is
somebody is born biologically as a man, right?
okay?
A male, let me use it as a male, born
Uh-huh.
biologically as a male, but the
Has
person,
trans.
yes, the person is now operates as a female, if I have to put it that way. So somebody
Yeah.
born biologically as a male and they still have their organs intact, right? So you're born biologically as a male, but your identity has now become, you're now
Female.
identified as a female. So it's a trans woman. That's what I mean. Like a
Uh-huh.
transgender woman, a woman who's assigned a birth, male
Okay.
birth, yeah, but they now have a female identity. If you
So
still
even
have,
for them, it's very important to do all these things that you've talked about as well.
yes, especially prostates. If you still
Okay.
have your prostate, you are still at risk of prostate cancer,
Okay.
even though you identify as a woman. Do you understand what I'm saying?
No, I understand completely.
Yeah,
Yeah.
so that's
No, that makes sense. It's what you
yes,
see, right? That you have
yes,
to talk about to be able to
yes.
encourage us to do better. So, from a proactive perspective, what I'm hearing you say is get those annual checkups. Get your 45 minute walk a day for 5 days a week. If you haven't done it in a long time, you can always start small. 15 minutes and build yourself to 30 minutes and then build yourself to 45 minutes. But the goal is walking and exercising and sweating, to Dr. Obinna's point. Get your annual checkups. And then
Yes.
based on the different age groups, you have to, when we say annual checkups, we're not just talking about physical checkups, we're also talking about dental. We talked about cleaning, we're also talking about eyes as well. And then when you get to a certain age group, we're also talking about the ears as well. But he's talked about from an annual perspective, pressure, diabetes, cholesterol, health, prostate health. Those are all important um, to do.
And if I may add, skin health, because men don't pay much attention to their skin as women.
Ah, thank you
Skin
for
health is
saying
very
that.
important. People need to
Yes.
go for a skin exam. Skin cancer is real.
Dermatologist, yes.
Yes, skin cancer is real. Some skin cancers are really very dangerous to have. So
Yeah.
they need to see a dermatologist,
And black people
regularly.
think that they don't need sunscreen. Black people, you need sunscreen just as much as anybody else.
Yes,
So put on that sunscreen, put on that hat when you're going somewhere to protect your skin. Don't, again, like I keep saying, we when we know better, we do better.
yes,
Protect yourself. Take care of your entire being. That's really what Dr. Obinna has talked about today. Take care of from your head to your toes, basically. Take care of your mental health, your facial health, which also includes your skin health, right? Take care of your
yes,
eyes, take care of your ears, take care of your prostate, take care of your colon. So basically take care of the inside, take care of what it is you're eating through your mouth and drinking. And please, 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 no smoking.
smoking.
No smoking in any way, shape, or form. Everything in proportion. So
Yes.
watch your sugar levels, watch your salt levels, and get your annual exams. Alrighty, so we're going to wrap this up. Dr. Obinna, again, thank you, thank you, thank you for the time and for the wisdom that you shared today. As a reminder to our audience, this is a special topic because I know I talk more about females or I talk more about healthcare, or should I say mental health, or I've talked also about women's health, but being able to tackle our men is very, very important because our men are just as important to us as anybody else. And so we want to make sure that the entire family unit is taken care of, and it starts with our men. So, men, this is for you to really take the small consistent steps to living that lifelong journey of being healthy. Make those doctor's appointments, keep an open communication with your partners, your family, your friends, but especially your healthcare provider. Talk about your feelings. There's nothing wrong about talking about your feelings. We don't want you to be strong. We want you to be healthy
Correct.
mentally, physically, emotionally. So please throw away those cultural norms that we've had for a long time of always being strong. We go through a lot as adults in life, and so it's very important that you are taking care of yourself and you're talking about the things that are stressful to you or you're worried about or you're concerned about. So please share your feelings. Don't wait for a crisis to start caring about yourself. Being proactive is really the message from this conversation today. Being proactive is critical to a healthy life and can prevent health crisis to improve recovery. So, Dr. Obinna, thanks for joining us and
Thank
sharing
you.
your expertise. We can, even our listeners, if you want to be a patient of Dr. Obinna, I know he has. Dr. Obinna, you have two practices, right? In San Antonio, Texas.
We have two locations in San Antonio.
He has two locations in San Antonio. Uh-huh. One is in Helotes, the other one is on San
1611 San
Pedro.
Pedro Avenue.
Okay, okay. And so, his website is www.zimamedical.com. He's also on social media at Zima_medical. So you can check him out there. I know he does a lot of things in his practice around weight management, right? Not just about the internal medicine and taking care of you, but he's also focused on weight management. Am I
Yes.
right, Dr. Obina?
Yes. Yes. You're
Yeah,
correct.
so he has a lot of good things in his practice. So please, please, please look at his website. If you're looking for a doctor, you don't have a doctor, check him out, and they will take good care of you. He's a great human that I know of.
Thank
Not
you.
not just to talk of, no, really, you are not just to talk about being a doctor. So being a good human being, you can imagine how that exudes into his practice, right? So he exudes those same principles of being a good human being by he's really passionate about his patients. So please, if you don't have somebody, reach out to him and he'll be great for you. Again, audience, thanks for tuning in to Deep Roots with NaijaBabeInTexas. If you found this episode helpful, give us a thumbs up, share with somebody you care about. Until next time, stay healthy, stay grounded, and keep growing through our deep roots. Thank you so much, Dr. Obinna.
Thank you, Ogeshi.
I
Thank you for all that you
appreciate
do.
you. Alrighty, thank you.